and we address their issues, and we try to help them out in the diet part, in the fitness part, so that they can remain fit and healthy.
Right.
And another important thing, as a surgeon, like we many times we the complex surgeries which we used to do by open surgeries, the cutting part, we are offering them more and more laparoscopic way, so that we can limit their hospitalization stay, thus complications rates can be reduced, and that is another way of helping my patients.
Right. I have a couple of questions already coming in from our viewers, but let me look at the adjunct to what you've said. How important, let me flip the question on its head. How important is it for people with comorbidities, underlying conditions, to be in regular touch with their doctors in the present condition?
See, it is extremely important to remain in touch, especially when you are the high risk patient, because the comorbid patients, they are the high risk people who can get the complications very easily if they get this COVID-19 infection. So they must be in touch with their doctor who can help him out. Even if they don't have, indirectly, they don't have any issues, but they should be checking their parameters with the help of their doctor. And it's very easy nowadays, like we are all afraid of visiting the multiple centers. The doctor can help them out, like obviously other than weight, blood pressure and sugar checking, if they are measuring and observing their other body parameters like bone health part, the muscle part, fat part, their mobility part, their diet part, their calorie requirement part, so that they can be in a right way. The shape will be maintained, the body weight will be maintained, they will remain enough active,
But then, Dr.
and that
Saab,
all.
what would you say to people? Majority, that's an Indian condition, an Indian mindset. No, no news is good news, right? So, what is your take on that? People do not see the necessity to be monitored. They don't, for comorbid people, what would be the symptoms, right? So, they don't feel the necessity to be monitored. Now, if I'm a comorbid patient, I have underlying conditions, and I feel, oh, no news is good news, I'm doing perfectly fine. Now, what should be my trigger points, or what should be the symptoms at which I say, hang on, I need to call up my doctor, which may not be COVID necessarily with COVID. It might be something else, right? Which might be pertaining to my peculiarity. Maybe I have I am suffering from CKD. I'm suffering from that would be a major part. Of course, I'm on dialysis. That's a different story. But maybe I'm obese. Maybe I have diabetes. What are the symptoms? If you could give us some idea that this is the time you need to talk to your doctor.
See, it's you are absolutely right when you tell, or we all believe when that no news is good news, and most of the time it is true. Most of the time, but there are cases when actually no news, that we believe that there is no problem, but the underlying conditions or the health problems are still happening. They are still worsening, and we may not be knowing. So the important thing is you must check your pulse, blood pressure, saturation level, and weight part, and are you active enough? And secondly, what you are eating. I think if you are having enough appetite, your bladder bowel movements are okay. If those things are fine, then you believe that no news is mostly good news. But if something is not in the order, even if it may not be important to you, just be in touch with your doctor. Let him assess, if by telephone or by the physical visit, but let him assess.
Right. So there's a question I'll take from one of our listeners, Mayank. He says, we have witnessed healthy individuals, and I know where this question is coming from. Okay, Mayank. So we have witnessed healthy individuals getting stuck with COVID and then eventually having a cardiac arrest after recovering. And these individuals have good muscle mass. What is your point of view on this, and how do you view this?
See, there are so many factors why the patient they get the bad infection or the complications. One important part is the virulence of the infection, and second is host factor. When we talk about the host factor, we generally believe the young chaps will should do well. But if the virulence is bad, and if they have not maintained other health parts, like they are young, they must be in the shape and size, but if they are not eating right, they are not active enough, they are not having good lung tidal volume and those things, then
Hmm.
definitely they are at high risk to develop the complications if they contract this COVID-19, and the problem can take them to anywhere.
So clearly,
We
it's
all
not
know.
just about muscle mass. Gut bacteria comes into
Yeah,
play, lung capacity comes
there are,
into play. These are things which are compromised in you, whether you're sleeping well or not. That could be another factor. What is the level of hypertension that you're undergoing, or what is the level of stress that you are undergoing? All
yes.
these play a part. Okay, that's a fair point. Now, if a patient of yours, I wonder, I hope not, but if a patient of yours does contract COVID, then what do you do in such circumstances? How do you proceed?
See, when the patient is having the COVID-19 infection, and we look at and if the patient needs the surgical management, and they have to visit us, then generally we look at the severity and the complications part of the COVID, and secondly, what is how much he is in the need of getting the surgery. In the emergency cases, we just follow the universal protocols. We investigate him at earliest, and we go for the surgical treatment also if it is required, because the patient has to be managed. Other than COVID, we have to manage the surgical problem also. So we have to go ahead. And in the non-emergency cases, we try to manage those issues by medicines, by other ways, at least for a time being, which allows them to recover from the COVID 19 problem. And then we always take them once they have recovered enough, once they are fit enough to undergo the surgical management. And that's what is we are doing almost in most of our non emergency cases.
So,
It's
just as an aside, Dr. Saab, I know we haven't spoken about this. Do you see more people kind of taking the surgical route or kind of contacting you for, surgical intervention when it comes to handling obesity or, of course, of course, there might be multiple underlying conditions over here. But are there more people who are asking for a laparoscopic intervention to address their issues?
Yeah, I mean, you are very much right for this. Like, so far, we have always understood that everyone knows nowadays that obesity is a health problem, and everyone wants to manage the obesity because of multiple reasons. But there are only two ways to manage the obesity. One is diet and exercise, and second is bariatric surgery, which we do by laparoscopy. And all of us, they are afraid of undergoing surgery.
Hmm.
So we want to manage by diet and exercise. But we know only 5% of the patients who are really morbidly obese, they are getting good control by diet and exercise. So if they are not opting for the surgery, then they just hang around. They just continue having more and more complications of obesity. But now, because of this COVID-19, we all know, even the last week also, the Times of India was having the headline that obesity people, I mean, the obese people, they get the more complications and the death ratio is higher. So, and that is what we are seeing nowadays in our patients, the fear part. They've understood they have to tackle the obesity. If they are not getting good results by diet and exercise, then they want to have the bariatric surgery, which is laparoscopy. They get the fast recovery and they get the good results. And obviously, like so many of my bariatric patients who have been operated in the
Hmm.
past,
Yes.
and like this last 1 year, many of them have definitely got the COVID-19 problems. Even few of them were having the kidney problems, cancer problems, but they were all done well because their obesity part, their diabetic part, their hypertension, the complications part were very much controlled one because of the bariatric surgery. They
Okay.
were in the right place.
Right, Dr. Mehta,
And
yes,
yeah,
just a quick adjunct over here. Those who have undergone surgery in the recent past, as you said, over a period of 1 year, have you seen a clear change in their attitude towards their recovery or towards being monitored? As we discussed, that's one of the major challenges. People kind of tend to
yeah,
go back on their own trail, after a certain point of time, they don't come in for monitoring, they don't follow the routine or the protocol set by you. Do you see a heightened awareness towards maintaining protocols, towards coming in for an in-body test or whatever test is it that you are carrying out to ensure that they are on track? And are they more serious as compared to pre-COVID days?
Yeah, definitely. It's true. Like we call it blessing in disguise in this COVID-19 time. Because our pediatric patient, most of them, even if they know that their consultation with the doctor, the follow-up with the doctor is very important for the success. Most of our patients who are having the Indian mindset, they don't want a maintenance cost. And here, even if there is no cost, they don't want to visit a doctor because no news is good news. But now they have understood that they require the monitoring. They require to be assessed. And here we use actually the clinical parameters to assess them. We use this in body composition analysis, which gives us lot of things, which it gives us lot information about, like, not other than body mass, lean mass, fat mass, calorie requirement, water part, the bone health part, and so on. And so they have been motivated, and they've understood that in a single hospital visit they are able, and in a very short period of time, it's a purely non-invasive way. So they are encouraged, they are coming more frequently, they are at least remaining in touch with us, they are seeking for the guidance, and that definitely helps us to manage the pediatric part.
Dr. Saab, we have a question from Junaid Khan. In fact, we have three or four questions, but I'll just take this one because this might help you, address this problem right now. We had this question later on, but Junaid asks, bariatric surgery is recommended for more than what BMI score? Junaid, we've addressed part of it, but that it's not just the BMI score anymore. There are many more things, but I'll leave it to Dr. Mehta. He's the expert to address this question.
See, there are many ways to assess the obesity and the diabetic part. But as far as the bariatric surgery is concerned, we take the patients whose BMI is more than 30, and if they are having the comorbidity, or if their BMI is more than 35, and even if they are not having comorbidities, we take the patients for bariatric surgery. That is what we follow. So, anyone above class 2 or class 3 obesities, we try to manage them by bariatric surgeries if they are not doing well with the diet and exercise part.
Right. Junaid, you see, bariatric surgery is no longer just addressed, it does not just address obesity or high BMI, but there are a lot many underlying conditions also. So it isn't necessary
Yeah,
really that you are above 35 BMI. Sometimes to address other factors also, to address other underlying conditions also, you have to address the question of obesity. Sometimes it's just not
yeah,
possible
like,
to. Yes, doctor.
yeah. So other than weight, what we are looking at the control of the diabetes. Then secondly is sleep apnea. If someone is suffering from the very severe degree of sleep apnea, then also we take the patient for bariatric surgery because this is the only way we can manage. And we all know the sleep apnea patients, they require otherwise the BiPAP for lifetime.
Hmm.
And now we know a lot about BiPAP and CPAP machines nowadays in this COVID-19 time.
Very true,
So
doctor.
these are the,
Hmm.
irrespective of their weight, we take the patients. Even if the BMI is in the middle category, we take them for the surgery.
Right. So conditions under which it's just not possible to reverse with the diet and
Hmm.
exercise. That Junaid also is a has a big role to play. Moving on to the next question, Dr. Saab. So now, how important has it become during this pandemic for you to get an assessment of what's going on inside a patient's body? Given the need to monitor comorbid patients, how often do you need some such assessments? This question is essentially how you go about doing it, given the restrictions that we are currently seeing.
See, I am a surgeon, and basic other as a medical physician, they are getting lot many patients for diabetes and other medical problems. But as a surgeon, like there are two categories where I come at almost in all my surgical problems. I always have to assess the obesity part, the sleep apnea part, hypertension and diabetes part.
Hmm.
But there are two, three conditions where I am very much inclined to assess this. These are hernias, because hernia patients, whenever I operate, the success of hernia surgery depends purely on the control of comorbidities. and
Okay.
second is this bariatric follow. So here come, I mean, I want to use the tool which is very handy, non-invasive. I can use it just in a fraction of time. And here I, so BCA examination, body composition analysis by in body, I use it so frequently, especially in those category patients, so that they can be motivated, they can be guided, when because they when they are having the data in their hand, they will believe it, and they will be motivated, and instead they will be inclined to follow the advice what we give, and that helps us in the surgical management for the success also.
Right.
And so
Hmm.
it's very common in our practice to help our patients by these ways.
Right, Dr. Saab, I have a couple of questions coming. One of them is, somebody called me up right before this, and the concern here is that the fear factor of going out and exercising. How does one address that? If you have, so apparently the gentleman is a diabetic, so his take is that how do I address that fear factor? In fact, I had another question coming in from on similar line. The gentleman is obese and he needs to cut down his weight by 20 kg. He's a young man. Now they are really worried because he's just 30 years old. So how do they, in the given times where you can't step out, you can't do any kind of exercise, and they feel that they need to manage their weight or manage their diabetes. In one case, I also had this query coming in from the somebody who had undergone a bariatric surgery, asking how do I do this. So how what is your advice to such people?
See, first thing I want to clear is whenever we talk about weight issue, and when we want to control it by diet and exercise, what I mean by diet and exercise, it is 70-80% most of the time it is diet, and 20-30% it is exercise. I believe diet is for weight loss and exercise is for fitness. So both are essential. But the most of us believe that as I am not moving out, I am putting on. It's not right. Actually, you are putting on because you are eating more,
Hmm.
and so
Okay.
we have to look what we are eating, how much we are eating. So the quality and the quantity both we should look at. We must address this issue even if we are not going out. Secondly, even if being indoor, we must find our ways to remain active. There are so many ways, like I myself, it's like the whole family joins almost the evening exercise or the morning exercise. When it becomes like a family time. Even my parents join them, the exercise part, so it becomes a fun time also for us. So the emotion, it helps us to grow emotionally, to I mean, it's a real family time, let me tell you.
Hmm.
So we must find out something which helps us to remain active even being indoor. And there are
So
so many ways. We use like lot many entertaining videos. We share it with our patients also many times. We And there are so much things available on internet. Like, and another thing, like personally, I use many this Xbox. Let me tell you, I will definitely advocate my patient to have this type of games in their hand because our kids want to use them. And the motion games, they help us to remain active. We also can be a part of their world. So there are
right.
so many ways to remain active even being indoor.
So, just for the convenience of our viewers and information, Dr. Mehta often conducts an in-body challenge inside his own office, inside his own hospital, for all his employees, and that
Yeah.
is something and which motivates them. It's a proper challenge. It's an in-body challenge. Whoever has shown the maximum improvement around it. So there's something which is going on in his workplace as well. What he advises is very clearly use any medium available to keep the activity going within your household. And given his schedule, if he can do that, I'm sure we can also follow some kind of guidelines, whether it's an Xbox, whether you're doing yoga. And according to him, in the case of obese people, and especially in the case of diabetes, the problem essentially lies with food. Exercising is important, but if you can control your diet, stick to the protocol, that will solve it. Am I right, Dr. Saab? Is that what you intend saying?
Perfect. No,
Right then.
you're
So then we move on to the last question. I'll take a few extra ones after that. Please hold your horses. I know there are a lot of questions. Just give me some time to go through this important part. Now we've already handled the exercise part, how we can do it, even if we don't go outside. There is one part which comes into play, Dr. Sab. How do we know how do people know that they have a comorbid condition right now? What do they need to do to right now? If me, give me stepwise kind of okay, do this first, then this, then this, then this. Sitting here right now, your advice to just everybody that this is what they need to ascertain right now to understand whether they have any kind of comorbidity, obesity, diabetes.
See, first is about the complaints. Are we having any complaints? Like, are we having enough appetite? Are we sleeping good? Our urine motion part is okay. Are we able to perform our day-to-day activity without any problem? If it's okay or not. Secondly, the checking part. Just to check the pulse, oxygen level, blood pressure, and weight. So these four things are very very easy. If we are doing good, if we are doing good, then another thing what we should look at is our mental attitude. Are we irritable or we are cool and calm? Because there are a lot of anxiety issues, irritability issues, frustration issues because of multiple problems. So if we are okay with this or not. So these are the things I would suggest to all of my patients and the colleagues and friends and even my the people working with me, that if they are doing having good part over here, then most probably they may not require any medical help. But if
Right.
there is something where they are lacking, then they must seek for the medical assistance.
Right. So we have a few comments. So Mayank says that losing weight with diet, that's essentially okay. You're right, Mayank. We already agree about it that if we are just dieting or following a protocol or not exercising, we will tend to lose muscle mass as well. Completely agree with you over there. And losing muscle mass while weight drops is not good for any individual. Yes. So while the protocol or following a protocol towards diet focuses around 70-80% on diet, you're right. But the Dr. Mehta, while doing it himself, also advises others, and he's listed a series of apps, gaming. These are methods through which you can keep the activity going and retain the muscle mass. So, right, thank you so
See
much.
here
Yeah, yeah, yes, please.
Yeah, here I want to add something like you will be losing muscle mass if you are not active enough. And right. So here you must concentrate on what you are eating. So you should be having good amount of healthy diet. Secondly, you should be active, but how can you monitor?
Hmm.
So if you can use
I think you've gone on
able to
mute. Yeah.
correct your deficiency.
Yes, yes, we can hear you.
Yeah, so I would insist everyone to have their BCA checkup, to have the clear idea where they stand, what they need to correct. So after, like, it is a protocol in our hospital to have a BCA checkup every 3 or 6 monthly, depending on the requirement. So at least we will know where we stand today and where we should improve it. This is one part, the information we must have about ourselves.
Right.